Welcome back. Okay, so the homeopathic medicines are approved by the FDA, but I think still people have some concerns over product safety and this type of thing. Can I overdose on something like this? Am I using it properly? And who is the one that's actually gauging how much of this I'm supposed to use and how it is supposed to be used?
Well, it's important to know that one can overdose on anything, even vitamin C, which is very, very benign. Any herb, any homeopathic remedy someone could take too much of. So there is a little guidance, but as long as someone follows what it says on the package, they should be okay.
Can we take them without seeing someone as yourself to give us guidance? I mean, can we just pick it up and read the label and go home and take it ourselves?
Totally, no problem at all. There aren't side effects in the homeopathics. The important thing to remember, though, is if it's not working, to stop taking it. Because homeopathics are kind of funny. If you take a homeopathic remedy and it doesn't work, and you continue to take it, it could actually begin to cause the symptoms that you were trying to get rid of.
So how long a period is that? 48
a day
hours?
or two.
Okay.
A day or two. If it's not working after a day or two, then it should definitely be discontinued. And a different remedy should be tried instead. And also, homeopathics are different from drugs and herbs insofar as if you take a remedy, homeopathic remedy, and it does work, you immediately stop taking it. Because also, while it's working, it's kind of like a catalyst, like a vaccine in a way. If you were to take too much of a flu shot, it would begin to cause a flu. So as soon as it begins to more or less, quote-unquote, vaccinate your system and you begin to feel better, you must stop it immediately. Otherwise, it will also turn around and begin to start causing the very symptoms that you just got rid of.
So really the body is almost healing itself after a point.
Exactly. And you don't want to overstimulate the immune system, because then you have just as many problems as when the immune system is shut down and not being stimulated enough.
Is there a role for homeopathic medicine in the world of traditional medicine? Can we successfully combine the two?
Oh yeah, it's my life mission to see the two combined. I would like nothing more than to work right along with traditional doctors in a hospital institutional setting. Patient comes in and gets referred to, depending on their problem, a homeopath, an acupuncturist, or a traditional MD. And in fact, in both of my offices, I share space with medical doctors because it's my belief that we all need to be working together. There's absolutely no conflict at all. It's just that there's an appropriate time and place for each. And right now, with our medical system, we're beginning to see the integration of a homeopathic approach, of acupuncture approach, and this and that, and the natural, natural combined with the traditional. But it's going to be a few more years before we actually see it in the hospital institutional settings.
And I'm sure people are maybe a little more broad-minded when it comes to something either chronic or something like the cold or flu, where they say, I'll try this.
Why not?
Why not?
Right.
But perhaps when it's something maybe a little more serious or a little more unexpected, they're probably still turning to the traditional medicines. Do you ever have a problem referring people to a traditional MD when it's something that's just not?
No. Well, for one thing, most of my patients are under the care already of a medical doctor, and I am in communication with their doctor. I never take anybody off of their drugs or other prescriptions. It's very important that they stay on them. That's the one thing we need to point out, that if one was to go to the pharmacy and get a homeopathic remedy, they shouldn't discontinue any prescribed drug. That's really bad.
And it's not going to have any effect on...
No, the two don't really interplay. They work on different levels. The prescribed medications work on a grosser, more material level. Homeopathic works on more of an energetic level. And I have a lot of patients, I treat a lot of hyperactive children, for instance, and they're on their hyperactive medications as well as the homeopathic. And for hypertension, for high blood pressure, I treat a lot of those patients, and we start them on the homeopathics, and they're still on their normal medications at the same time. People can take the antibiotics and be taking vitamins, herbs, and homeopathics. There's really no conflict between the two schools of thought at all.
It's nice to hear. Yeah. What about preventive medicine? Obviously, we'd rather not have any problems at all. Is there something, a lot of people take vitamins, hoping that that will be the preventive wall that keeps them from having trouble. Is there anything prevention-wise?
Well, probably about 20% of my practice is prevention. People come in, they're basically pretty healthy. They don't have really any complaints at all. I had a woman come in the other day who really has no physical health problems at all, but emotionally she wanted to get to a higher level of creativity. She's at that midlife place and feels like she's kind of cut off from the creative urge that she had when she was younger. So we work on that level, and at the same time we're working to strengthen her overall system so that she won't be as apt to get the kind of physical problems that she got genetically, basically, from her parents and grandparents. So by working preventatively on that level, and homeopathy, herbs, acupuncture works very well for that level. Someone can come into the practice and have no problem at all. I check the pulse, I look at their tongue, and take their complete history and the history of their family, and I can figure out where the imbalances are and begin to treat imbalances, which are called subclinical, because they don't show up on blood tests, they wouldn't show up on x-rays, but they do show up in the traditional Chinese pulse diagnosis and traditional Chinese tongue diagnosis. So it's a very interesting way of treating, and very effective way of making sure that we don't get the same problems that we otherwise would get 20, 30, 40 years down the line.
And people are very much afraid of,
yeah.
They hear, you know, they hear about all their friends got this or whatever, or I have a family history of this and I don't want to get it.
And it's unnecessary. Just because there are heart attacks in the family, one doesn't need to be worried about that, because we can do things to prevent it from occurring in the future.
And of course you're a nutritionist as well. You work a lot with what we eat, which of course we're learning now has so much to do with our health.
I basically design a dietary program based on the person's constitution. We spend a lot of time talking, we do extensive blood tests, and we figure out a particular diet for that person's type. I want to emphasize exercise, sleep, and emotional balance are just as important. In Oriental medicine and homeopathy, we always emphasize balance in a person's life, not overdoing anything.
Good. All right. We need to take another break. Stay with us.